All right. All right. Good evening, everyone. Thank you for being here with us. My name is Tamika Jackson. I'm a mother, a community organizer, and someone who is deeply rooted in the work of Black maternal health and reproductive justice. We are gathering here tonight during Black Maternal Health Week, a time where we not only name the realities of maternal health crisis, but we also center the voices and experiences and leadership of Black mamas. And tonight, we are being intentional about who we center. This conversation is about Black disabled mamas whose experiences are often overlooked, misunderstood, or left out of the broader conversation around maternal health. And we know that the risks don't end at birth. We know that access to care and is not equal. And we know that when disability and Black motherhood intersect, the barriers deepen in ways that systems are not always prepared or willing to address. So tonight is about listening, it's about making space, and it's about honoring lived experience as expertise. This is not a space where we speak over people. This is a space where we are led by the voices of those who live this every day. Our goal tonight is not to just name the challenges, but to better understand what real support really looks like in our communities, in our healthcare system, and in the policies that shape our lives. I'm grateful to be in the space alongside Dr. Brandy Bentley, Tamika Sitchin Spruce, Christina Hayes. Dr. Bentley will help ground us in the clinical context and the importance of centering Black disabled mamas within care systems. And with that said, I'll pass it over to Dr. Bentley.
Awesome. Thank you, Tamika. And hello, everyone. We can see your comments as you all are leaving them in the chat. So keep giving us shout outs and saying hi as you join and get comfortable. We'll be here for a minute. So grab a snack, some water. I know I have water and coffee because I need coffee at 6 o'clock as well. We want to welcome you just as Tamika just did. And thank you all for being here with us during Black Maternal Health Week. I just want to emphasize that this gathering was created with so much intention, so much planning, and so much creativity to make sure that we are honoring and elevating voices that have historically and continue to be left out of critical conversations regarding Black maternal health. And as Tamika just stated, something that was really important to us in the development of this event was that we aren't just spending time naming and understanding those disparities, but we also have set time aside to move beyond describing the inequities to go into that next phase of what does it look like to co-vision, what does it look like to co-create, and what does it look like for us to have very intentional and reserve space for conversation about developing solutions for change. And so, as a part of tonight's conversation, we're going to focus on one part of that system, which is clinical care. And so, we know that clinical care is a vital part of transformation, but it's just one piece of a broader ecosystem that includes community knowledge and policy change and collective accountability. So, we're really excited for all of you coming from diverse backgrounds with diverse expertise to be joining us in this space. For a little bit of background, my own work sits at many of those intersections. So I'm currently an assistant professor in the Department of Family Medicine at the University of Michigan, and I also support families across Detroit as a community-based doula. So I have some doula background, research background, and I'm also trained in social work. So across all of these roles, I'm sitting on many conversations. I'm sitting at the research tables, I'm sitting in clinical spaces, I'm sitting in community practice, and have very tangible insight into how maternal health experiences and outcomes for Black disabled mamas are shaped through these systems. And I think, in addition to that, I also recognize the power of community rooted care and having lived expertise in interdisciplinary conversations to drive that change. And so, thank you again for joining us. Throughout tonight's live stream, you'll hear from mamas, you'll hear from birth workers, you'll hear from advocates and clinicians who all bring professional expertise and lived experience. And we're going to talk about some great stuff. So, like I said, I'm always encouraging people to get comfortable. I have my blanket, I got some coffee, and I'm seated and ready to go. And so, with that, I will pass it to Tamika to get us started.
Here we go. Here we go. So, yes, hello everyone. Tamika Sitchin Spruce. Again, as just to reiterate my co-moderators, I'm really excited to be here with all of you today. We're gonna have, like everyone said, a really good time, a great conversation during this week of Black maternal health. And just want to thank, for Mothering Justice, Tamika, Christina, all the team at Mothering Justice for collaborating, with me to do this event. It's really a passion of mine, why I co-created Divas in the City TV, so we can have these, continuously have these conversations. Some of these faces are familiar to Mika and Christina because we and Brandy as well, because we had a great conversation on cervical cancer screening. So that's what we're about, just continuously creating a space to tell our stories and elevate. So before I get started on the first panel, we're going to hear from a Black mama who, Felice Turner, who really sent us a great message. One of the things that we did was we requested, submissions from Black mamas, disabled mamas, across the country to send in their story. And so we're going to hear from one of them now, Felice.
Celebrate this Black Maternal Health Week, I want you all to really focus on this week's theme. I really want you to focus on the joy that comes with being a Black mother, that comes with being a Black mother who has a disability. Oftentimes we are told that we can't do this, that we can't be mothers, and that's just not true. So if you are in a situation where you feel like you can't do this, you're feeling like maybe as a woman with a disability, just having a child isn't for you, that you may not feel supported when it comes to finding an OBGYN or finding a tribe, a community of mothers, believe me, we are here. We are here for you. Find the joy. You can do it. We're all here for you. We believe in you. Go, mama.
Yes, yes, yes. I love that message from Felice, to have a joy. There's a whole community, as you see here, that is what's, disabled mothers be safe, to have a voice, and to be part of it. This beautiful experience. Also want to give a shout out. Can't forget my sister, Dr. Brandy Bentley, as well, who is a U of M researcher and doula, as well, for women with disabilities here in the Detroit area. So definitely want to give her a shout out. So I am, let's get ready to move to our first discussion. And so we'll see Tamika and Brandy um, back in a minute. So, all right. So today we have, or for this first hour, we have Christina Hayes. She'll share a little bit about herself, but she is a great sister, lupus warrior, all that great things. And then we also have Karen Gasparini Quelez, and she is a great mother as well, author. She has two children's books. I'll let her go into that, but Ariana Magic Books. And she's also a star here on Divas in the City TV. So you will, if this is not your first time here, you definitely, have seen her in her story. And we also will have Melva Henderson, who's also a mother, playwright, and also the star of Divas in the City TV. She will be coming in a minute. So let's get started. So the first question, I'll start with you, Christina. If you could just introduce uh, yourself and introduce yourself.
Hello, happy to be here with you, Tamika. But my name is Christina, and I am a mother. I call myself a lupus warrior. I say a lupus warrior because I was given a diagnosis and I refuse to let that have me defeated in life. And I figure out how to thrive in life in spite of. So I feel like that's my definition of a lupus warrior. And I am a lupus warrior turned advocate. And my advocacy led me to a mothering justice organization where I am also now a paid leave organizer, where I work on paid leave policies, making sure that Michigan workers get access to paid time off. So I am just grateful to be here and this topic of Black Maternal Health Week. So, yeah.
Yes, thank you. Thank you. Glad for you to be here. So, Karen, if you can introduce yourself.
Hi, everyone. I'm Karen Gasparini Keelis. I'm a mother also and a children's author. My books are available on Amazon.com. My books are called Ariana's Magic Boots, and they're based on my daughter when she was a toddler. And they're basically about her and her leg braces that she calls her magic boots. With them in her imagination, they take her on magical adventures.
Yes, yes, yes. Great series. So my first question is, let's talk about for a minute navigating pregnancy with a disability. So we're gonna keep it first, with you, Karen. If you could just describe, how did you prepare for your pregnancy journey, and what were some of the significant physical or logistic barriers that you encountered? First with prenatal care, and then with postpartum care.
Um, Starting with my pregnancy, for me, it wasn't, I'm a disabled woman. I didn't look at it that way. I was just a pregnant woman. So I just went and was like, we here in Rhode Island, we have one of the best women's baby hospitals called Women and Infants. And once they found out, obviously, I was pregnant, I just went through the steps that they have generally for any pregnant woman. And then when it became where I looked at the aspect of my disability, I wanted to maybe take it a little further. And I started to see like a geneticist to see, because my condition is very rare, that it is genetic. So my daughter, they told me, would be 50-50 chance of her having it, which she does have it. So it was more just seeing what my body needed, not my disability, because my disability has nothing to do with having a child or risks to the child. It was just that the genetics wise, she might have it, she might not. That's what it more was. And the prenatal part for me was I have low potassium, so I had to like live on bananas. I don't even like bananas that much now. It was just they my ex-husband was just give me bananas all the time. I'm like, oh my God. So even smelling a banana, even Ariana smelling a banana, she's like, I can't take it. And it's like that's how much bananas we had to have because her potassium and mine was very low when I was pregnant with her. So that was more the safety of it. Um, as opposed to just my disability as well too. I had my mom, and my mom went through a lot with me, kind of like trial and error, in the 80s when I was born, when there was no ultrasounds, no nothing that could help my mother prepare for me. So I kind of used my mom to guide me on what she went through to better the care from me and my daughter this time. And I was also blessed because thanks to Dr. John Montgomery, who was my physician when I was a child, became Ariana's physician. So it was more like having someone who went through it with me, the doctor, and advocated for me when I was a baby, advocated for my daughter as well. So that was a blessing that I had. And, God rest his soul because he passed away, I think last year or so, but he was in like 80, 90 or something. So he was all my siblings, pediatrician, and then he became my daughter. So it was great to see him, especially when it came to my daughter being born and they would say certain things and he's like, oh no, her mom had that, she's fine, the baby's fine, let's just do the regular care, give her shots for the every shot that the baby needed, everything that she needed. And I was blessed in that sense. But the post part, the only issue I actually had was when Ariana was going to be born, they looked at me and my disability and they assumed I couldn't birth the baby. So that's when the issue came in and where I had to raise hell. Like, wait, what? They wanted to assume and set up a C-section for me. Oh, she's not going to be able to do this. Let's do a C-section. Let's do this. Who said that? Did I say I can't do that? Did you know what I mean? Did my doctor say that it's going to be a strain on my body? No, they just assumed that I couldn't. And I like to report that I had her natural with no drugs. So who was laughing then? while I was watching while I was watching Law and Order, just so you know. So my daughter to this day loves that dung, the song when it because she was birthed at that song. So yeah, that was more the pushback I had. Was they assumed that because of my disability I wouldn't, and they was like, oh, if we give you an epidural because my severe scoliosis, it might only numb half of my body, it might not, it might this. And I'm like, I'm dealing with enough. I really didn't want any more drugs to like make it an issue for me to recover. So I said nothing. I didn't want nothing. I can do it. And I just watched Law and Order and just birthed my child and went home like I was ready to leave the next day. I just wanted to take a shower by myself so bad. So I'm just like, without feeling pregnant, I wanted to just go home and take a shower. So it was surprising to them because they were all talking about me, and I was like, my mom said I've always been the one to give everybody something to talk about, so I was happy about that.
Yeah. That is a thing that I've experienced as well as a mother. That when you have a disability, they automatically deem you as high risk and automatically deem you as having a C-section. And so, my disability is have a spinal cord injury, and so yeah, it's. I'm glad you were able to, fight for that, care. And that's important to give women with disabilities a choice,
Yes.
and it's not automatic because you can have children naturally. I've seen, women with higher injuries as I than I, who's quadriplegic, have limited use of their arms and hands, and they had it naturally. So, most definitely, Christina, what about you? What was your experience like? Like, was you like, did they pressure you to have a C-section, or just share a little bit about your experience?
Oh yeah, so just even from the beginning when we talk about prenatal, for me, I was out here. I am a lupus warrior that just got done dealing with lupus nephritis, where I was dealing with kidney failure, and I had just did a year of chemotherapy, and I was on this shot called Lupron, and so the Lupron shot was supposed to, shut down my ovaries, keep them quiet, and kind of send my body into or early menopause type state. So I wasn't even having periods or anything when I found out I was pregnant with Genesis. I was like, oh my God, I'm what? So
Oh,
doctors were shocked too. Like, you got pregnant, you're pregnant, Christina. Like, after I was done with the chemo at that point. So it was just like they presented to me. The first thing they said was like, "This is dangerous. You're high risk, and this means that you could die, or the baby could die, or you could both die." And it was just like, well, wow. Well, thanks for presenting me with all the horrid things that could scare me into this journey before I'm even, you know, taking it in into my brain that I'm even pregnant. You're presenting me with all this fear in me. And, I wish doctors wouldn't do that with people that have lupus, or tell lupus patients, oh, you won't be able to have a child, or you won't have a child. Because here I was having a child with, being in menopause. And even still to this day, I'm 39 and I still don't have periods. So I'm still in like this menopause, and they still haven't figured it out what happened. But my daughter, she was able to come into this world. She came premature and early. I was induced into labor because I went into the ER with the extreme hypertension. Was dealing with preeclampsia. My
yeah,
blood pressure shot up to like over 200 over 212 when I got in there, and they were like, we got to take the baby now because you could have a stroke, and we don't want you having a stroke with a baby inside. And then with me having lupus, they were saying that a C-section was not going to be a safe route for me either, because my healing process would not be good at all due to the my history that I already had in the hospital. So I was in labor for 2 days because I wouldn't dilate, and they had to break my water, and then I ended up with what's epidural that ended up causing me to only be numb. Or I was numb till after I had Genesis, and I could barely walk because one of my legs wasn't waking up. I was so scared. That had me thinking, like, if I ever had a kid again, I'm just gonna take the pain because I don't want to have a fear of not being able to walk. And then doctors, after I even had Jen, I was so drugged up from being on the magnesium trying to bring my blood pressure down that I couldn't even hold Genesis. And I'm just grateful for having family that was there advocating for me the whole way and just watching everything, because it's like, just because you're, high risk, um, or I felt like the doctors were considering like my pain that I was talking about, linking it to lupus or other things, when this is more going on, with me having a baby. So the postpartum phase, it was even a journey, but I can relate with you all with, having to advocate with how you want to have your child, and the whole C-section push is a thing. I'm just grateful that my doctors, like, knew that my healing process would not go well on that route. So yeah.
Yeah,
yeah,
the
yeah,
the only thing I did forget to mention is that they were obsessed with was my umbilical cord.
Hmm.
They wanted my daughter's umbilical cord to study, because since my condition is so rare, they wanted to me to sign away that when my daughter was born, the geneticist wanted me to sign away to give them the umbilical cord so they could study the cells in it. And that's what made me push for my to advocate for myself, because I literally got in the car with my ex-husband and cried my eyes out, like, they're making me feel like a lab rat that they want. And I was like, I'm
yeah,
not signing anything away. It's my daughter's my, I didn't. And that's when I was like, what do I, this is crazy. I know who I am. And my mom cussed me out, black mamas don't play. So she cussed me out and was like, you know who you are, you know who raised you. You need to talk for yourself. I can't always be here for you. So that's what made me push later on. Like, no, I need this, I need that, and this. And then that's how I was able to have my baby natural.
Yeah, yeah, yeah. I can definitely see that as disability. That's a thing too. Yeah, definitely. Doctors sometimes, want to, you be a guinea pig, and definitely relate to that. I know there's a whole history of Black women with Ariana lacks and things like that, where black bodies are studied. So that yeah, there's a whole historical thing. So we have Melva here, Melva Henderson. As I shared, before, she is a playwright. She is a founder of her organization in Texas, Living Beyond Limits. And she is one of the stars of here on Divas in the City TV. So you see a lot of her encouraging, commentary as well. So, Melvin, if you can just share a little bit more about yourself and what your journey, pregnancy journey, prenatal and postpartum as a woman with who have visual challenges.
Yes. Thank you so much for having me. I'm just curious. Can you see me well?
Yes, can see you. Yes.
Okay. Perfect. Okay. Um, well, with my son, I have two children. So with my son, it was pretty smooth, easy because I wasn't blind visually impaired at the time. However, what made it not so smooth is because I had a emergency C-section, and it was due to doctors really didn't make it clear with the nurse and things like that. So it was really scary. So fast forward, it made me have to have a C-section for my daughter once I had her. And so the whole thing was like we couldn't do, I guess they call it feedback. So you can't do a delivery if you already had a C-section. So when I went to a different hospital with my daughter, I actually, in the first stages of my first trimester, I had to go backwards and forth to different doctors because they thought my vision was hereditary, that they wanted to test my daughter. So I remember going to like doctor's appointment all the time, and it became overwhelming because I had to let them know this is not hereditary. My vision, when I, go to my daughter or anything like that, she would not inherit it. This is not something that she would get. And so my doctor at the time was actually scared to even keep me as a patient. And so he really recommended that I go somewhere else. And I was really frustrated because I was like, oh, wow, I've been here before. I wanted to stay, but he did not want to keep me as a patient. To him, I was high risk because I have a shunt, which is a small tube that's in it comes from my brain. It goes all the way down into my stomach. And so in that area, it was like, well, we don't want nothing to happen to the baby. We don't know what's going to happen, things like that. So for him, he was super afraid. And he started to make me nervous. I was really scared. I was like, oh, I gotta get away from him because my anxiety became very high. I didn't know what I was doing. He was like, well, I don't know how to assist you. And I'm like, well, you're not doing anything. You just, So, with all that being said, I end up going to a different doctor, a really great doctor. And it actually worked out really well. But I think the bigger thing it's just really like everyone probably was saying, it's just knowing your body. But I didn't know what to expect to have, well, because I have a shunt. And so when I had my son, I didn't have a shunt, and so I didn't know like with the tube, would it bust the back? Well, it was just all kind of questions I was having, and then the anxiety. I didn't do a lot of research. I didn't know anybody that had a shunt that was also pregnant or had a child. So yeah, it was scary, but she came. She was 7 pounds and 9 ounces, so she was pretty big baby. So it all worked out. I think the other part of it was difficult was breastfeeding. The lactation is um, they were really, oh, we don't know how to help her, we can't do this and we can't do that. And it was just because they felt like, oh, my vision was interrupting their daily task or something. So it was really weird. The whole thing was weird. I just, thinking about it really kind of just upset me sometimes, but I'm like, wow, yeah.
Yeah, yeah, yeah. That's a whole different, that's a whole issue there. And I know that's, we are, trying to work on, I know with Mother Justice and also with Dr. Bentley, who will be coming back at the 7 o'clock hour, so that we can have clinicians and advocates who can, kind of answer some of the solutions to the,
Hmm.
what we're describing today. But that is what I've seen a lot too. That breastfeeding, lactations, doulas. A lot of people don't know how to support women with disabilities, and so with various types, and so we definitely there needs to be more education and better because we should be able to do all those things as everyone else. Um,
Right.
and
I had
so,
one lady,
yes,
she was like scared to touch me. And then one lady she wasn't scared, but she just grabbed my breast and I was like, okay, what is going on? Like I was just so nervous and I didn't know how to speak up for myself. So really to have someone in place to help you advocate, to kind of walk you through that process, I think will be very helpful.
yeah, yes, with the doulas, and yeah, to have someone there with you. Um, as far as with, going to Christina, I know you shared a little bit, during your story, but I'm just asking and wondering, can you share a moment where you felt your concerns about your body or your baby were being dismissed or gaslit by the medical staff?
Yeah, I can say that I was definitely blessed throughout the whole entire pregnancy with the high risk team paying attention and listening to me. It was during the postpartum, the after, where
Okay.
I was constantly saying like, okay, I'm feeling really nauseated. Something might not be right. And I ended up going to the bathroom. And I tell people when I went to the bathroom, I think it might have been some more afterbirth or God knows what, because it was so much blood that came out and I was terrified and I started throwing up. And I'm like, that part was ignored and that made my blood pressure go up. And they were just making it seem like, this is normal, this is okay. I'm like, no, I just saw in the toilet when I went to the bathroom was not normal. And then there was an issue with the simple IV placement in my arm. I kept telling the nurse, like, my arm is feeling rather sore. I think I probably need a new IV. Something's wrong with the IV. And about like 1 hour went by, right? And she came back to look at the IV site and my skin had blew up, boiled up, like some reaction happened, and there was this huge boil under that soft wrap that the IV is under. So in order to even take the IV out and off, they had to pull back that plastic and it ripped off my skin with it because my skin was boiled under it. So I was just had Jen, my daughter, premature. She was only tiny, 5 pounds. You could hold her just in the palm of your hand, and just to even hold her with where the IV site was like right on my arm. So it was hard to hold her because one, I got one leg still trying to recover from barely being awake from the epidural shot, and then now I got a third-degree burn on my skins because they end up pouring some type of little white cream. It looks like this white milky substance they poured over. They said that's what they use on burn victim skin. So because my skin was just completely raw where the IV site was, and that just made me so curious. Like, for people to ignore my pain, and here I am, a new mother. It's my first time having a child, and you know, feeling ignored because my child's father, we weren't together at the time, so it's just me as a single mother here. I'm wondering, like, are y'all treating me different? Because not only am I a high risk patient, but then you don't see a father, but you see my family, and then like, it's like what you when you wonder about how you're being heard is a lot plays into that of is it the color of my skin, or who do I have to be? Do I have to be your sister, your cousin, your wife to be heard and seen was a real thing. So that's
Yeah.
Yeah, 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 exactly, exactly. What about you, Karen? I know you shared a little bit before, so did you ever, feel gaslit, or was there a particular thing that really sticks out to you?
Yeah, there's actually several incidents when Ariana was little, but uh when she was, I want to say, a baby, because of my condition, like I said, is rare. We also are born with club feet. So I already knew everything all about that because I went through it with my mom and everything like that. However, I knew she was gonna need casting and AFOs. That's basically what the leg braces that her my story series is about. She was, I believe, 2, 3 weeks old, and I brought her in to get casting to correct her club feet so that way the more they grew, because they're so soft and flexible, they could straighten them out, cast them, and then so she can grow and her bones will harden and they would stay straight. So the doctor that was there, some lady, she just completely ignored us and just was putting the casting on with her assistant, and my daughter was screaming, just screaming. And she's like kind of torturing her, trying to put it on. And then I'm getting upset and I'm like, you're not even paying attention. Mind you, this white lady, I'm sorry, I don't, it's not all Caucasian, not all Caucasian people, because they're great too. Some of them are great.
Yes.
But this lady was so worried about her 5'4" and her going to Tahiti, and she was like, "Yeah, I went to Tahiti." And she's telling the guy, "Oh yeah, I did this and I took that." And I'm like, "Are you serious? You don't see my child screaming on your table while you're like?" She's like, "Oh no, she's fine, she's fine." And I'm getting more and more upset, and Ariana's father's trying to pull me back because I'm starting to flip out. And he's like, "She knows what she's doing. She knows what she's doing." And I'm like, she doesn't look like she know what she's doing. She's worried about her cabana and what she gonna drink when she go to Tahiti. So I was like flipping out, and then she's trying to do it and everything like that. And then she does one leg, and then they're like, "Oh, you have an emergency call or something like that." And then I'm like, "So you're gonna leave my kid just sitting like there?" And the guy's like, her assistant's like, "No, no, I'm gonna take care of her and everything like that." So then I'm like, no, somebody else needs to sit with my child. Not, no offense, but I don't like newbies. I need somebody who has credentials with my child. So then they send in another doctor, and he comes in while she goes and handles what she's doing. This doctor comes in and he turns the lights down. Wraps my daughter up, calms her down, and I look at him and he's like, mind you, this is another doctor, white doctor, but didn't care about, he was multimillionaire, didn't care about trips, didn't care about anything. But you can tell when someone's a father or someone's a parent. And the lady that was worried about her trips and stuff, you could tell she's not a parent, she's not a people person. So this man came in, comforted my daughter, took care of her, wrapped her up, calmed her down, put the next cast on. I said, I want him. I don't want that lady come back in this room. I don't want her near my daughter. I want him. And he's like, what's going on? I said, no, I don't want her. He's like, oh no, I don't care. I don't want her near my daughter ever again. If she steps foot in there, I'm doing a complaint. And they was like, oh no, she won't even be over there. Thank you. And from this day, he's still my daughter's doctor. She calls him Dr. Mishka Mushka because they both like Mickey Mouse Clubhouse. So
That's cute.
Yes, yes, yeah, yeah. That's yeah. You have to be able to really, to advocate, and so we're gonna get to that in a second. But Melva, I know you shared a little bit too, different instances, but is there something, a moment that really sticks out that you felt like you was gaslit by the medical staff?
Right off the back, no, I can't think of anything. I think it was just more so when he did not want to continue you know, working with me or being my doctor, for me being a patient with him, his concern also became alarming. It was like, I just don't want to be bothered. And I don't think it was all just because I'm blind. I do feel like it has something also to do with, the fact that I am a person who's disabled, but also black. And so I think that had something to do with it. Yeah.
Yeah, yes, yeah, yeah. I see what you're saying. And that's a key thing too, is that we have, we're disabled, but they're also black women. So it's the intersectional things. You really don't know sometimes when you're dealing with the healthcare system or dealing with any of these systems. Are they treating you this way because you are black, or is it because you're a woman, or like you said, Christina, is it because you're a single mother, or is it because, disability? You just really don't know, during those times. So it's hard to navigate. And so my question is, what strategies did you use, or that you recommend other mothers to be, or women, black, women who have disabilities or chronic illnesses? What kind of strategies, did you use to advocate, or do you recommend to do to advocate for yourself when it comes to engaging with these professionals? Give it to Melva, since your last person.
I would say actually kind of start to create your own treatment plan. Like, what does that look like? And when you say advocacy, I'm thinking more so like we have to be more intentional with our doctors, making the best choice for our families. Sometimes we just go with the doctor that has the best reviews, but it's like a job vetting it out and to seeing if this person's going to be, going to take care of me for the next 9 months. How are they? And I think that's one of the things that I will start to look at more, even, not just going through pregnancy, but just going to, your doctors or your checkups. I'm 40 now, and so I have to go do all of those women things, right? And so one of the things is just really understanding who those doctors are, but also knowing that what I'm going to put up with and what I'm not going to put up with. I think sometimes we get to a point where the doctor knows best, and then we just kind of go with the flow. If you feel uncomfortable, say something, do something, and your words, who you are, it really does matter. So I encourage people to show up, not just say, hey, I'm having a problem, but if there's a good thing that's going on, I would say be one of those ones that write a review and give back in ways like that. And so just speaking up, being more intentional when we choose our doctors. And yeah.
Yes, yes, yes. I love that. What about you, Christina? What advocacy that you
I
did or
I
recommend?
love how Mel said be selective with your doctors. I made sure that where all of my healthcare providers are under one roof. I have multiple issues, multiple health concerns with my chronic illness, so I wanted all of my healthcare professionals like all under one roof to make healthcare decisions together. Because I've witnessed being a support group leader for other lupus patients when you have doctors in multiple different their health systems, they don't communicate well, and your treatment plan can go awry. So definitely having your knowing where you're going to have your baby at and having that plan. And then also I would say it's important that I know we all try to be strong, we all try to be superwoman, but we've got to have a support group. I know it takes a village. This is definitely gonna take a village. When you're pregnant or you're about to have a baby, you gotta have a village. And I was just so blessed to have a best friend. Like if you don't got nobody else, have a best friend. And she spent the night with me the first uh, day after I had my daughter. So I'm truly grateful to have a person that was there to be a voice when I couldn't for myself because I was so out of it from the drugs. Like there's gonna be some medications that can have you not at a point where you can make decisions for yourself. So it's really, really important to find that one person. And trust me, if you don't feel love, you are loved. Some people feel like it's a burden, or they feel like it's a heavy thing to ask somebody to help. But no, you need to ask. And trust me, if somebody who loves you you're gonna be surprised who shows up and is there by your side. But it's important to have a person there to advocate and be the voice when you aren't able to.
Mm,
Yes,
yeah.
yes, thank you. That's great. Yes, gotta have a community, your tribe. What do you think, Karen? What worked for you?
Um, exactly what these two lovely ladies are saying did work for me as well. I think another thing that worked for me was to, I would say, listen to yourself. Only you know yourself better than anybody else knows yourself. So just because these doctors are telling you, oh, this is what it should be or that should what it be, because they're going by their expertise, they don't know you. They don't know what you feel. They don't know what's going on with you. They don't know what your symptoms are. Even if you're telling them there's your symptoms, sometimes they make it as, oh, you're just pregnant, or you're just, that's part of your disability, or you're this. It's like, no, just because I have this disability doesn't mean it takes away from being pregnant, just like any other woman who might be having these same symptoms. So keep advocating for yourself, but also listen to your body. If something feels off, it's off, no matter what they're telling you. And that's what you need to push for and advocate. I noticed I pushed more and gave myself more of a voice when I had my daughter, because I didn't want them to do what a lot of the doctors did to me growing up,
Mm,
because like I said, my condition is very rare. So they try to use me as some type of training guinea pig type thing in the 80s. And my dad's Italian and my mom's black. So it's like they already looked at my mom weird as it was, because I came out high yellow and she's the black woman. So they're like, is this really her daughter? You know what I mean? So she went through a lot of advocating and learning, and she taught me to do the same. So by pushing and listening and knowing, it's the best thing. And that's what I did for my daughter when they tried she had rods put in for her scoliosis, and they put the cast on so tight that she couldn't even breathe, and they wanted to use her as another guinea pig and put a hole in her throat to make her breathe. Yeah, they tried to slit. The doctor literally told me he's going to puncture. He's like, oh, just be a little hole. It would help her breathe better. She's not breathing right. We're checking the monitors. We're doing this. And that's when, for me, I have my Lord and Savior Jesus Christ. He's like, honey, nope. You know it's not right. And I was like, something's not right. Let me check. I said, no, I feel like you have it too tight. Oh no, nothing's not too tight. She's fine. We did the hand. They said we did the hand print or whatever crash they come up with, where they put a certain amount of fingers in before they put the brace on after surgery. They said, yeah, we did the hand finger thing. I said, I don't care what you do for other kids. This is my kid. And you're not using her. So this arrogant prick over here can use my kid for these little kids that are newbie to learn how to be a doctor. Because everybody wanted to see him put a hole in my kid's throat. And I said, no, you all can leave. We're not going to do that. So I said, you get Dr. Mishka Mushka, as I told you, have him come and tell me that this is what Ariana needs, because he's always had Ariana's interest, and he's part of, like Christina said, have your team and who advocates, and he's always advocated. And he came in and he said, Karen, you're the mom, you're the boss. What do you think? And I said, I told them, no, they're not doing it. He said, well, we're going to do what mom said. She said, loosen the brace. And if it comes out that she needs something else, we'll evaluate. Lord, tell you when they loosen that brace. My daughter said, I said, I told
mm,
you. Exactly. So
Oh my
who needs a
goodness.
hole? Yeah.
Mama
And
knows
then
best.
exactly. So
Yeah.
listen to yourself, and if you believe in Christ or whoever you worship, listen to that person and advocate for yourself, because only you know you're the mom, you're the boss, you're the
Yeah.
president, they're Secret Service. Let them know.
I like that.
Yes, yes. Wow. Wow. That's yeah. Yeah, it could be something else. Oh my goodness. That's just but I hope people, who's that's watching right now see that, these like this, you have to advocate, and yeah, wow, it's just woo. That's deep. That's all it needed was just to loosen up the brace. Wow. So we have a few more minutes, and so 10 more minutes before we move on to our second panel with clinicians and such. Um, okay, so the let's talk about autonomy just for a minute. So I would say, Melva, what does autonomy look like to you in the medical setting? And how can providers better respect the choices of Black disabled birthing people? What does autonomy look like to you?
It just goes, it's really simple. It's my body, my choice. If I choose not to follow your treatment plan, it's my choice to do that. I think a lot of times we think or we feel like the doctors are the expert, and they are, on paper, right? They are the expert when it comes to that part of it. But just like Karen was saying, you know your body. You understand, and I always suggest doing some more research, trying to figure out what would be most beneficial for you. It's your body, your choice. If you choose not to do a treatment plan that they chose for you, no, don't take it. Or you can say, hey, you have the right to say, let me think about that. Let me make a decision on it. And I want to, take some time, and I want to spend that with my family and try to figure out what would be best for me and my child. So yeah, my body, my choice.
Yes, yes. I love that. What about for you, Christina? What does body autonomy look like to you?
Body autonomy to me, when it comes to speaking towards medical professionals or doctors, I like to people tell them to talk to me, not at me. Like I know I'm your patient, but don't talk at me about what the plan is. This is what we're gonna do. This is what we're gonna give you. This is the medication we're gonna do. This is procedure. No, you're gonna talk with me. We're gonna come up with a plan, and you're gonna explain things to me and make sure that I'm heard or make sure that I understand and make sure that you're communicating in a way that I feel that I am valued and that I am a person. I can't stand when doctors look at a paper or they're not even looking at you as a person, encountering or even thinking about what decisions that they do to you, or how that's going to really affect your day to day after you leave. So definitely treating patients or anybody in their care like they're a human being and looking at them, um, and, you know, acknowledging us. I would say is where I see body autonomy could go.
Yes, most definitely. And what about what does body autonomy or autonomy look like to you, Karen?
Basically what the lovely lady said, that's it's all about choices and what works for you. And I've had it where, as Christina said, that where just don't be afraid to uh, put your foot down or stand up for yourself. I've had it where doctors talk to my Ariana's father, like I wasn't even there, like I'm just a child, and I'm like, who's pregnant here, him or me? So, and then that's when I'm like, nope, I don't want this. I don't want this person. I want somebody else. So don't be afraid to be like, oh, this relationship is not working with this clinician or physician or anybody that is working with you in your body or your child. Don't be afraid to stand up for yourself and see what's comfortable for you, and just say, you know what, this isn't working. I need somebody else, because you have that right. A lot of people don't realize they have that right. They assume that when they have somebody working with them, a doctor, a clinician, anything, surgeon, they have to stick with that person. No, you don't. You have to stick with who feels right for you and who is going to be take what you're saying and accountable. And that's why I to this day love Dr. Mishka, because he always said, "Mom, you're the boss. What do you think?" And then he would tell me his expertise as a doctor, and I would tell him my side as a mom and as her mother, and we would figure out the plan together. And that's what I like. And when it came to my OBGYN, I went through three ladies before I found who I was comfortable with. And
Oh,
always know that you have that choice. And that's the biggest thing I believe.
yes, 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 yes. I love that. I love that. All of you gave really great answers and such. So we could bring back Tamika for a moment. For comments and questions, and then I'll come back
Yes.
to you three just to one last comment. So bring back Tamika. I see there is some comments and such. So, what are some of the things that you've seen in the chat on Facebook and Instagram and YouTube?
I saw McKees Taylor asked, how can we get books? I guess she was
That's the
asking the
Karen.
author, yeah, asking Karen, how did she get the books? If you could drop your link, I will share it in the chat for everyone so that they can find your page. And she said to please look up Detroit Champions for Hope. I am familiar, but not deeply familiar, so I definitely think that's a great connection to make. As far as like expanding on this conversation, um, I know that people were talking about having family doctors. A lot of people don't frequent the clinical setting as often as they need to, because of the experiences that they have. So I think it's really important to like find a good doctor and have that be like your whole family doctor. Like, we got to get back to when you just had like a family doctor.
Mhm.
um I think that's what she was really emphasizing. I think that's a really good way to kind of build a stronger connected network. And she just I think we need to go back to having just one doctor. um and they like to put people in fear. They like to put fear in people. um it's a way to kind of control you. It's fear-based control, you know and they want you to feel like you don't have choices. So I love how Melva and Karen, you both were talking about how you're going to ask questions, you're going to say no, you know what I'm saying, you are certain about the type of care, the level of care, and what supports you need, and being very vocal about it. That's really really important. And then Jamie Jr. said happy maternal health week, and this is such an important conversation. I'm really happy that we came together to have this conversation and uplift it. But that's all we have in the chat for now.
Yes, yes, yes. Thank you. Thank you. So, as we end, just go around and ask everyone to, where can we find you and everything. So, Christina, so you coming back for the second hour, but Christina, where can people find you?
Well, I am on Facebook as the Christina Project. You can find me there. That's my public page of where I lead support groups for lupus warriors. And then also check me out. I'm on the Mothering Justice's website there too, as one of the staff members. So feel free to read about paid leave there.
Yes, yes, thank you. And Karen, where can people find you and your books and everything?
I'm You could find me on Karen Gasparini Keyless, and the way my name is spelled on this live on Instagram. And also, it's Karen and Juan on YouTube. We have like a small YouTube channel right now. My children's books are all available at on Amazon.com. I put it in the chat. The books are called Ariana's Magic Boots, and that's basically it for
Yes,
now.
yes.
Anyway, yeah.
Yep, yep, yep. And Divas in the City TV as well.
Definitely Divas in So to find me easily, just go to Divas in the City TV, because then you won't have to worry about if you're spelling my weird last name right. So
Yes, yes. Yes, thank you. And Melva, where people can find you.
I am on Instagram at Melva underscore independent living queen. I'm on TikTok, Melva shares. I'm also on YouTube, Melva Cherie.
All right. And Divas in the same TV too. So,
Oh
uh,
yeah.
yes, yes, yes. So, thank you, Christina, Melva, Karen for participating and giving us a great insight into, what it's like to be a Black disabled mama. And thank you very much. So, now I am going to play a short video. Again, we put a call out um, for Black disabled mamas to share their experience. And so we're going to um, share right now one of the mothers. And then once we're done with that, I'll give it to Brandy, where you will hear from other great speakers and clinicians on how to better help Black disabled mamas.
Supportive maternal care for me looks like putting the mother first, being concerned about her health, her wellness, and her emotional state before the children. Mothers tend to be at the end of the list. When family comes over, when you go see the doctor, it's all about your children. But in reality, when I'm in the doctor's offices alone, dealing with my conditions, it really feels good when they ask me about me. They ask me how I'm handling the stress of motherhood. They ask me to make sure I'm taking care of myself. So maternal care looks like focusing on the health of the mother, the well-being of the mother. Because the mother got the kids, she needs someone who got her.
Awesome. Thank you for that transition, Tamika. While we wait for our next round of panelists to join us, I just want to say, oh my gosh, that was amazing. I have all my notes. I was sitting here scribbling so many notes. And so just thank you, Christina, thank you, Melva, and thank you, Karen, for sharing your stories, sharing your vulnerability, and trusting us to hold space with everything you brought to today's conversation. We appreciate all the insights that you all shared and are excited for part two of this conversation. As we're getting everyone joined, we encourage you all to grab some water, take a stretch, do whatever you need to do to take care of yourself in this space. Um, Eat a snack. I know that's my favorite thing to do, always. And we encourage you all to keep engaging through the comments. We had some great comments and engagement. All right. Awesome. Well, hello, Jamie, and hello, Dr. Mitchell. How are you both today?
I'm well, thank you. I'm happy to be here.
Also doing well, and I have a helper today.
We love helpers. Welcome.
Yes.
Welcome.
This is
Awesome.
Sydney.
Hi, Sydney. You gonna join the conversation? I think you got a lot to tell us about what you
You got a
do.
lot to say always.
All right. It looks like we can go ahead and get started. So to open us up, I'll have you all share introductions and you can just tell us a little bit about yourself and what perspective or lived or professional experience you bring to today's conversation. And I know it's hard to tell. Is it okay if I call you out? Jamie, you want to go first?
Sure, I can go first. Hi, everybody. My name is Jamie Jr. I'm a Detroiter, a lifetime Detroiter, disability justice advocate, and also a social economic justice advocate. I have been a parent for 26 years. So before we struggle now, but before we moved into the 2000s, the struggle was really real. And I had my child in 1999 when the struggle was really real. And I'm so happy to be here. I'm so happy things are getting better. And I'm so happy to be exploring solutions to make it even better still.
Hello, Christina here. I'll go next. My name is Christina, and I am a lupus warrior. So I call myself a lupus warrior because I was given a lupus diagnosis, but I refuse to let that get me down. And I find ways to thrive in life in spite of having a chronic illness. And my diagnosis led me to become a paid leave organizer as well. So I work on policy work around paid leave, making sure that Michigan workers don't have to choose between taking care of themselves versus a paycheck. And I feel like that's my passion and purpose, being a mama and having an amazing mama myself, seeing her have to quit a job to be by my side in the hospital has really shaped me into the person doing what I am today. And I'm just happy to be here with you guys today.
Thank you. Dr. Mitchell, we'll pass it to you.
Um, Hi, my name is Leah Mitchell Solomon. You guys just saw my two little two little people. I am an OBGYN at the University of Michigan. Specifically, I'm an OB hospitalist, which means that I only take care of moms while they're in the hospital. I don't have a clinic site. Um, I am a mom of two. I have a 7-month-old and a soon to be 4-year old. Um, I am a sister, a friend, um, and that's my lived experience and my professional experience.
Wonderful. Thank you all. We have such an incredible and rich mix of lived and professional experience. And I also recognize that there may be folks joining us for the second half who weren't here for the first half. So I'll also do a brief introduction. My name is Dr. Brandy Bentley. I am an assistant professor in the Department of Family Medicine at the University of Michigan. And I'm also a community-based doula here in Detroit. So all of my research and practice looks at ways to support disabled women and think about how we can increase accessibility and inclusivity of perinatal services across the continuum. And so I'm very excited to be here with you all. To start us off, I know Jamie, you mentioned something that was really interesting, that you have been a parent for 26 years and you've seen this evolution of care and different changes across time. So as you all reflect on your own experiences and positionalities, what would you identify as the most critical gaps in care for Black disabled mamas?
As I look back, oh, and I did forget to mention, I'm sorry, everybody, I am a woman with cerebral palsy, um, and I use a wheelchair, just for reference. So, for me, I think the biggest gap for Black disabled mamas is seeing somebody like us taking care of us, really. Somebody that understands the struggle firsthand and has the compassion to give us what we need.
I think for me as a clinician and as a Black mom, the biggest struggle I see is a lack of communication between different care teams that may be involved in someone's care. Um, I forget who was mentioning. Oh no, Christina, it was you who you were talking about making sure all of your doctors were in the same health system, because if they're across systems and they don't always communicate well, and that is like a struggle of American healthcare in a nutshell. Um, and sometimes the onus falls on you to make sure that like all the doctors are talking to each other, that somebody's not making a plan that contradicts somebody else's plan, and that they're coming together to make a plan that suits you as the patient.
And I'll just definitely echo off these beautiful two ladies here saying the same thing. Just being, I feel like being seen and being heard, just as a not only a patient but as a person as well, is where I've seen the major gaps in advocacy and relation as far as patient doctor relationships and anything getting solved without that at all from starters is a big problem.
Yeah, thank you all. I think that really echoes some of the conversation that happened in the first panel as well. I pulled out themes of compassion and continuity of care. Like those will go so far. And when Melba was sharing her story, that was the first thing I thought about, like going into a doctor's office and expecting care and the provider saying like, I can't do this. My next step would have been like, but here's somebody who can, right? Like, can I make that referral for you? Can I close that gap so you're not left trying to balance and find and trial through all of these providers? Like if you can't do it yourself, what is your backup plan, and how can we shift that responsibility from being solely on the patient to having care systems that more delicately hold folks and recognize that there's a human, a very human element to all of this. Like people are balancing so many different things, and getting care, getting holistically well care is hard, is really hard trying to find that in some spaces. And that affects our mental and emotional well-being. And I think that was something that stuck out to me in the first panel. Is like, this is demanding, it's emotionally taxing, it's physically taxing, it's stressful, and then all of that piled on to you're having this experience, and pregnancy in and of itself brings all of these other things. And so anything that somebody could do to check off the list or remove a responsibility that you have in that space can be like a breath of fresh air and very lightening to the load. How have you all witnessed bias and assumptions show up in clinical decision making or interactions when it comes to supporting Black disabled mamas?
I mean, I think I forget who. I'm so bad with names, and my mom brain is kicking in, and so I'm so sorry. But someone spoke earlier about doctors assuming that because of their disability that they weren't able to push um, during and have a vaginal birth, and that they automatically needed a C-section. And I think that's the biggest thing that I see and that we try to combat is making assumptions about what someone is able and is not able to do, rather than just asking them, like, can you be positioned this way? Like, how can we, best accommodate keeping you safe, but also allowing you to have this experience? So, not just making assumptions about what someone's able to do.
I think that I agree with you, Dr. Solomon, but I also think um, sometimes the bias can be that this wasn't something that was planned, it was an accident, so now we have to mitigate damage. Um, I remember for me, doctors assuming that they had to protect me from my partner. And um, then also, too, I would have other physicians think that I was not cognitive cognitively present enough to answer questions and make decisions about what was best for me and my body.
And then I'll go ahead and echo just off you all too. But one of the bias and things that's happened amongst Black women is just not being heard or not being seen. Once again, that is a topic always, and that comes from like when we're saying that something is wrong, we feel it in our body, and that's ignored. Like, hey, I have this headache, and something is wrong in my brain. I'm feeling it. Something is off, or and that could lead to somebody's blood pressure going sky high or them falling into a stroke, or our pain being ignored as Black women. Like, my God, that's always a constant when we're ignored and we ask for pain medication. Are you a drug addict? Or we get labeled all type of different things I hear it all the time as being a support group leader and a person that visits other moms and people that struggle with chronic illness in the hospital. When you're not heard, or somebody's completely ignoring you already, that's always really a main huge problem.
Absolutely. And something I really appreciate about today's panel is that we were intentional about including perspectives from folks who have apparent disabilities and also folks who have non-apparent disabilities. And so when people are going into clinical spaces, providers may not always know, like, does this person have a disability? Are there other elements of their care that I should be aware of? And I think that really stood out to me, Christina, when you were talking about that earlier and how you were experiencing pain and they tried to connect it to your lupus. And you're like, I need you to hear this, right? Like, this is something that's happening and this is separate from my disability. And I think, especially for folks with chronic illnesses or other conditions that may not necessarily be apparent, like Dr. Mitchell said, ask, right? Like, as a provider, I think that's a very simple first step. Ask people, what do you want? What does empowered care look like for you? How is there anything about today's appointment that can be adjusted, or any accommodations you need so that I can better serve you in this space? And I think starting from that space of curiosity and asking can be really impactful. So, as you all think about the biases and assumptions that show up in things that you've experienced, what would you say accountability looks like when dismissal or harm occurs in care?
Shucks, accountability. Sure, that looks like I will call the what was it? It was a patient advocacy something line when it comes to I'm because you at a U of M hospital. U of M hospital, I feel, is one of the best hospitals in the world, and everybody travels far and wide in Michigan to come there, and everybody tells me how blessed I am to have all my specialists there. But even there, I have been ignored, or I felt like my doctors weren't following protocol, where I'm in the hospital for 3 days and y'all are still ignoring me. So accountability means, even if you have the top number one doctor in the hospital or in the country, you still can call their boss. There is someone over doctors in every hospital that you can report an issue to, and they will handle your issue quickly. I called this specific line, and you can ask a nurse or someone on the floor. There's a lot of different advocates and social workers who you can reach out to, that will report if you're having an issue as a patient. And it's so important for us to not be afraid or feel like we're gonna have some type of consequence happen because we use our voice. And as I tell my 12-year-old daughter, use your voice. And it is just so important to know that the doctors are wonderful and we are grateful for them, but there is someone that is above them who can hear your concern, because maybe this has happened to multiple patients and you can stop it from happening to the next patient after you. Maybe this person needs correction. So there are hotlines, or there's a number that you can call, usually within the hospital, where you can report what is happening with your doctor.
Thank you for that, Christine. I think that's a huge part of it too. But I'm thinking about something you said, Brandy, about empowered care. And for me, along with having someone above my doctor, what accountability looks like for me is for them to check in with me every so often so that we're on the same page. And if they made an assumption, apologize. I've been in situations with physicians that feel like they know everything. Accountability sometimes is saying, I don't have the answer to that right now, but let's work on figuring out what it is. Let's bring in somebody else to the team. So you're holding yourself accountable to your patient, to your profession, and to your colleagues.
Um, I don't know where Christina went, but I really appreciate she and Jamie's perspectives, and just the simple acknowledgement that if an error is made, disclose it. If you have misspoken, apologize, because that's part of relationship building, and that's the only way that you can move forward. I know at U of M specifically, we have the patient relations line, but we also, oh, can you hear me now or no?
Mm, I'm muted. Can you hear me, Dr. Michelle?
I can hear you. Can you hear me?
Yes, I can hear you talking.
Oh, okay. Thank you. Brandy, can you hear now?
Randy, can you hear Dr. Michelle?
No, I'm not able to hear her. I think it's maybe something on my end. Let me see.
I can hear everybody. Can everybody hear me?
Yes.
Okay.
Okay, I can hear you now. I think it's something on my end.
Okay.
Sorry about that.
No,
Thank you.
no, that's okay. I just was gonna echo what Christina said about don't be afraid to call patient relations. And honestly, um, if I have had a situation happen with a patient that I've either been involved in or not, I encourage people to call to document what happened, because if it happened to you, it probably happened to somebody else too. And that's a systems, either it's an individual issue that we need to fix, or it's a systems problem that needs to be fixed, and we can't address it if it's not documented. Um, I don't know if anybody else gets there here at U of M, but we also have what's called a health equity service. And so if you feel like you are experiencing like bias, whether it's race, ability, what have you, you can ask for a consult for that health equity service to come in. And that team is made up of a physician and ethicists, and some other people. And it's really just like it kind of calls the team in to look at the care they're providing, to look at, if any biases are happening and how to address it. So don't be afraid to call patient relations. And if any good provider should welcome that, because that's how we improve things.
And I had just one more thing I would say when it comes to accountability. When you said when it comes to harm or what is it, when dismissal or harm occurs, I would say the teachers of the medical students, who is teaching them, who is telling them before they even become doctors, what to expect or how to treat people. And I'm just really grateful for my rheumatologist who brought me on as a patient presenter, and she does these patient presentations, telling their medical students, like, this is how you should interact with a person that has this X, Y, and Z list that shows up in your chair or in your operation room. This is how you interact with them, or this is the medication, or this is the symptoms and things that they're dealing with. So reaching back into the doctors themselves and holding them accountable for preparing these doctors when they're medical students to be ready. That's a start where we can hold people accountable at.
Yeah, I agree with that, Christina. I think it's so important to have patients of various backgrounds be a
Yes.
part of the teaching process.
Yeah.
That the idea of standardized patients, I don't know if it's taken, as seriously as it should be, but it really should be a thing that all physicians have to go through.
Yeah.
And Dr. Mitchell, can you speak to that a little bit? Can you tell us, in your experience, how you've seen clinicians trained to serve individuals with disabilities, or what that looks like in practice?
Yeah, and so can you still hear me? Okay. And so standardized patients are actually like a mandated part of medical education. No, I can't speak to what it was 10, 15 years ago, but I know that that is one of our like things that our regulatory boards look at in terms of an appropriate medical curriculum. So um, For us, what that looks like is making sure students have access to patients from different backgrounds. Um, and then from teach a lecture to our students on maternal mortality in the United States, which focuses primarily on Black maternal health because we're the drivers of that increase morbidity mortality. And so um, as part of that panel, I bring in, midwives, doulas, community activists, you know, and often they are people who have given birth as Black women themselves. And so it's important, I think, for them to hear people's stories and connect that story, with a diagnosis. So someone is not just their diagnosis, and it helps to see the whole person and hear that person's like birth story. And I think that's really like sticks with them. So it's our job as educators to make sure that we like bring the textbooks that people read or whatever they're like learning to life so that they don't, they see people beyond their diagnosis.
That's so important. I think I like to emphasize that in research work as well. Like, there's people behind this data. It's not just a statistic that we look at on a PowerPoint and go, wow, that's sad, or that's really discouraging. Like, that this represents individuals. And it's so important to us because these are our stories. And so I think that's the level that makes it more different and personal, especially in research spaces, because it tends to be largely homogenous in the underrepresentation of marginalized populations in research spaces. And so when I'm entering the spaces, oftentimes I look around, I'm like, oh, there's no one else like me, but we're having these conversations about Black maternal health and all of these things that we should do. And it's like, this hits closer to home. Like, this is my story, this is my mother's story, this is my cousin's story, right? Like, it's real life stories that we are impacted by on a day to day. And I think for some folks in this space, they can make that separation, right? Like, they can say, this is the data, I understand that this is happening in populations, but it doesn't have an impact on how I live my life, right? Like, no, this is shaping how I show up to my doctor's appointments. It's shaping who I select for care, right? Like, at every interaction, it's informing my process. And I think that is something that's really different, and really influences the way that we show up to this work and the care that we provide and the experiences that we have. So I really appreciate that. And we talked a little bit about this next question throughout too, and you all have mentioned the attitudinal barriers that look like bias and discrimination in care. You've spoken to care coordination or the lack thereof and having to piece those things together and what gaps occur when it's not done well. But are there other significant systems barriers that impact care for Black folks with disabilities that we haven't talked about yet?
This is Jamie. So I agree with all those other things, and I really love what Christina said about having your care in one place. Sometimes that's hard to do if you can't travel a long way, like travel to Ann Arbor on a regular basis to get those physicians there. Sometimes you have to piece it together. So I think this is another big thing of communication is missing, because I feel like the onus is on the patient to say, well, I think you should speak to my PM&R to find out how to best work with me before you give me an epidural, right? Because if my spine is curved, you want to know where to put the needle so it works. So communication is extremely important, and a lot of times I think it's underrated. Well, maybe not by us here. We're here today, so we know how important it is. But I think sometimes you get and it becomes automatic what you do, so you don't think about those pieces. How do I make this patient feel comfortable in my presence? How do I ask the question of what do you need from me? So I think that's missing, that personal relationship.
I would say all around we have there is lack in our lives, like when it comes to resources, when it comes to outside situations, like as far as like even our economic wise, our families financial situations, folks jobs, like the benefits that you have, like do you have access to paid leave? Some people, you get sick and yeah, I can take off work and I'm gonna be right here by you, but us, we don't have that, or our family dynamics are a little different. So, just, even outside dynamics, that families need help when they're in the hospital. Like, I've gone to visit lupus warriors, you could be having a baby or something else, but you more worried about when I get out of here, my lights might be off, so a person's not even com- uh, focused on their healing. They're more focused on what's happening at home. And, there's already, life is already against us systematically, that it's already we're at an unfair advantage that needs to be looked at, that ends up equating all across the board, under multiple situations. So
Yeah, I think social determinants are extremely important, and culturally competent care, right? Because that plays into the social determinants.
mhm.
When you're um thinking about it that way, no, everybody doesn't have the same needs, but being cognizant that those needs exist help you be a better clinician to everybody.
Yeah.
Dr. Mitchell, do you have anything to add for this one?
No, honestly, I'm just really enjoying listening and taking notes that I can bring back to the students and the residents that I teach and educate. Yeah.
Thank you. Yeah, I appreciate you, Christina and Jamie, for elevating and naming that. Because sometimes I think that's a really big piece that we miss. And I'm always thinking, like, what are the lowest hanging fruits? What can I do to improve somebody's situation today with little resources? And that has led and influenced the way that I show up in my doula work. I always tell people, like, doulas are really good friends. That's how I like to describe it. Like, you're a really good friend who knows how to show up and hold you. That's what a doula is. And I think through a lot of my work, that's what it has looked like. Like, it's looked like going to people's home and cleaning up for them, right? When capacity is low. It's looked like connecting them to resources for gas cards so they can get back and forth to appointments. It's looked like picking up a grocery order, right? And dropping it off at their house because transportation may be an issue. And we all know that the DoorDash prices are egregious. It's wild. It's wild. Grocery is too high, and the prices to have it delivered to your house is even higher. And so I'm always thinking through, like, what can I do within my current capacity to lighten the load for someone? And it doesn't have to be this huge miraculous thing. I think as a part of this process of visioning and thinking through as a community what it looks like, I would say community care. Like, we need really, really deep community care, in the way that we show up and take care of one another and hold one another in these spaces. It's like, that's just what I needed. I needed somebody to come through and cook for tonight. And so I can put some food in the refrigerator, and meal plan and have something to eat for the next few days, because I'm always, I shouldn't say impressed because I do it myself. Like, how are my basic needs not how are my basic needs being missed on a day-to-day basis? Because I think we often get caught up in the run of, like Jamie said, everything's automatic. You're just doing this and this and this and this and this. And then you look at the clock, and you're like, it's 3 o'clock and I haven't eaten anything but a glass of coffee today, right? And like running on fumes. And as a big part of sustainability in this work, we had to take care of ourselves and we had to take care of one another. And I just think that that's simple. I think it's a little bit more simple and tangible, and something I can at least easily grasp in my own care. And it's like, as I take care of those folks, other folks in my community, I'm taking care of myself and pouring into myself so that I have capacity to show up for others as well. So it's a really helpful reminder. Yeah.
Yeah.
For our next question, we have, what does respectful care look like for Black disabled mothers in practice?
Well, this is Jamie. I'm gonna say it looks like the things that we just talked about. Understanding that there could be extenuating circumstances. There could even be language barriers. Two people can speak English and they saying totally different things. You know, understanding each other, being respectful, honoring who I am as a person. Ask those questions about how can I best accommodate your needs. Is there somebody that needs to be here? Would you like your pastor to come in or something like that? Just things like recognizing that people have a plethora of different values.
And I guess when you talk about respect, I always am one of those patients that are telling the doctors, like, who do I have to be? Do I have to be treat me how you would want your wife treated? Treat me how you want your sister, your daughter treated. That is what respect you. I mean, who God knows if you don't treat them right, then I don't know. Don't treat me like how you treat them then. But I always wonder, like, who do I have to be? Just treat someone how you would want someone you love treated, you know? And I know that's a lot to ask doctors, and I don't know what's taught as being a doctor, how you would feel with your patient, but when it comes to respect and treating someone right, just as like as Miss Jamie said, it's just like what we already been saying, like listen, have a person feel seen. They always, it's this quote that they say, like, a person won't remember what you did, but they'll remember how you made them feel. So a person can remember, like, yo, that doctor made me feel just so much better. Like, no matter what was going on, I felt better. I felt like I could handle it. I felt like I knew what my next steps were to my healing. I knew what my treatment plan was. Like, that is respectable treatment, you know, that is respecting the person as a whole, not just as a patient. But yeah.
I guess my perspective is maybe dual, as both the patient as also as the physician. But um, for me, respectful care means, listening more than you're speaking, as the clinician. So, like, if you ask someone a question, give them a chance to answer it fully. Don't talk over people. When I walk into someone's labor and delivery room, I want to know who the person is, who's, with them in the room, how that person plays a role in their life, and, what what can we do to make this birth experience special? What are you expecting out of this experience? Not just like, okay, these are the next steps for your labor care. Like, you're here to give birth, but like, what is important to you of this experience? Because that's different for every person and every family.
Yes. So you all emphasized the power of human connection, listening, and also understanding what value people are looking for in their care experiences. I think those are all really meaningful considerations. Yeah. With that in mind, what would you say is one concrete change that providers can do immediately to help improve care and outcomes for Black disabled mamas?
Um, for me, as a woman with a physical disability, make sure your space is big enough to treat me, where I feel comfortable and welcome with my device, with my support person if I so require.
I would say implement some mandatory trainings. You know, like, I know all jobs have these mandatory trainings that you have to do. There should be some type of mandatory um, personal training that each, person has to go through that deals with pregnancy and disabled women. Like, and it doesn't even have to be Black women if that's the big deal. But pregnancy and disabled women, or disabled women in medical care, should be a thing, a training specifically for. I guess not so much as, like, I don't know if people need to be empathetic, but they need to to understand in some type of capacity better than they already do.
Yeah, I agree. And I guess the other thing that I'll say is not just in the birthing space, but in the space of raising children, it's already stressful to raise a child. If you don't have any mitigating circumstances, add race and the issues that come with race, add disability and the issues that come with that, I should not have to be on guard with my physician who I'm expecting to help me care for my child.
I think like one thing I would try to encourage people to do is to find out one piece of information about your patient that has nothing to do with their medical care. Like just one piece of information, and that'll help to kind of like ground you in who this person is. And it for me, I love knowing people's families, their stories. I want to know, about the retirement party that you're going to. I want to know, what your kids are doing, like who's going to whatever. I want to know those things, and so I encourage people to just find out just one small thing about someone that has nothing to do with their diagnosis or their like whatever's going on.
I love that, Dr. Mitchell. I would pass out if my provider during an initial appointment was like, tell me something that has nothing to do with your care. Because it just gets at what everyone has said. We want to feel like humans and you care, and I think that's something that really stood out to me about my primary care provider. The first time I met her, I was having all these issues and people were ignoring me and putting it off as other things. And she was like, no, Brandy, like, we will figure this out today. And she did. And I had a long appointment. My first appointment was an hour, but she took all her notes and she came up with the solution. And my problem was solved. I went back in 3 months and I was like, this is great. Life is well. And I was, I can't believe I went that long bouncing provider to provider, having all of these different things shared. And all it took was for her to hold the space, which I know is not always feasible. Like there's so many things that influence how long providers can stay. But because she took that time and she was willing to take that risk and say, like, no, I need you to tell me everything. And I had told her like 5 years worth of history and all of these experiences that I had, but because she had the time and space and capacity to sit and listen and put those pieces together, she was like, the solution's right there. Like it's been here the whole time, but I don't think I had gotten to the point where I was able to share that fully with any of the providers that I had seen. And so they were just going based off of what I had time and space to share in that appointment. And that changed my experience and my perspective. And I was like, I'm gonna stick with her as long as I can. And my appointments are super fast now. And just go in for routine care. And I haven't had any other challenges along the line. And that was something that was so powerful to me. And I think like feeling like I was heard and I was seen, and her saying like, we're going to figure this out today. I was like, yeah, we are. This feels good. And so I appreciate all of you being aligned, and really uplifting that, because it does matter and it changes our perspectives and it changes our expectations. And I think also, like Jamie said, thinking about how the space is set up, because everything in our environment sends us a message that yes, this space was built for you, we're ready, we care. Or it's the opposite. It wasn't built with you in mind. You don't fit here. This is not the space for you. And that impacts our psyche and the way that we think about entering spaces, and the comfort level that we have as well. So, thank you for bringing all of those things up. Are there any other comments, or are you all ready for the next question? Next question. Okay. So, what is a policy change you think is the most urgent?
You said what is the policy change that is most
Mhm.
urgent? Oh, I'm with Christina. We need to make sure that the physicians are having culturally competent care for all patients in their orientation, their first day on the job. Like there needs to be a panel of people that talk to them about their experience the first day?
I think I mean I agree that there should be a mandate that you talk to people and hear their experiences, but from a system standpoint, I think all systems should be required to look at their data and their outcomes um, based on like different drivers. So like it should be required that you look at your rates of like C-section for Black women versus white women for people with different disabilities. Just hold them accountable to the care that they're giving.
When I get to thinking about policies, I get the Mothering Justice Organization. We are all about policy change and policies. So I get to thinking about what our organizer Tamika is working on with maternal health and making sure that there is a larger, like state policy made for postpartum care that looks at the mortality rates that are happening amongst Black women. Because I've talked to researchers that have looked at the numbers, and you can see with the numbers alone the discrepancies that are happening amongst Black women. So I hope that our policy change can reach the governor and the written law we've made that'll help with the postpartum care and look at the issues that we're facing. And then when it comes to paid family leave as a policy, I want that to be passed. That's a right now need so
Mm-hmm.
that families are not falling into financial hardship when it comes to times of crucial care, needing to take time off work to care for themselves or loved ones. So I feel like those outside policies need to be passed to be able to help people that are going through the storms in their life, personally in the hospital too. That can help as well.
Yes, yes. All really important levers. So we have training and education, increased awareness, data. That's a big one. Like, is your hospital system even collecting data on patients who identify as disabled so that you can look to see how well are you providing care, and what their care experiences are like, or even in some of the tools that you all mentioned earlier, like the patient relations resources and the health equity service as a part of those services and resources, collecting that demographic data so you can go and analyze and see like who's being missed, whose needs are consistently showing up, and is there a pattern? Like, is there different areas that we need to target? And then also thinking about postpartum, because folks fall off of that care cliff in postpartum. During your pregnancy, you're going to your appointments on a routine basis, and then postpartum, you go in for your 6-week checkup. And then what, right? And then people are asking the questions about how's the baby, and no one's checking in with parents as much as they do, and as much as they want like cute baby pictures. Like, send me cute parent pictures, right? Like, how are y'all doing? What do you need in this season? And how are folks taking care of you as you navigate new life and all of these things? And so I appreciate all of those recommendations for
If I
sure.
could add, if I could add one more thing, you encourage me so much, Dr. Brandy, as a doula. I would love to see hospital systems and clinicians have doulas and maternal caregivers that look like the people that they serve, that can identify with the struggles that people have. It would have made a big difference for me if I had had a doula.
I don't know if people know or are aware. Christina probably knows, but thanks to work of organizations like Mothering Justice, a lot of insurance companies actually cover doula care during prenatal care and postpartum. Or I don't know if postpartum is covered just yet, but prenatal care and labor. And so you can find your doula, see if they take your insurance company, and a good hospital system will welcome them with you throughout the entire experience. But just a matter of people knowing what's out there. So doula care is covered by a lot of commercial and like Medicaid insurances now.
Yeah, that's a huge policy change that has significant implications. In the state of Michigan, Medicaid covers doula services, and it is an incredible amount of coverage. Most of the families that I serve have received Medicaid, and I've been able to support them through that policy expansion. And I mean, like some of the insurance programs under Medicaid have an unlimited amount of appointments. So there is no cap. You call your doula as often as needed, and they will support you in providing those services to families. And so I always emphasize with families postpartum, postpartum, postpartum. Like once you have this baby, call me every week. I'm going to text you. I'm going to check in the wee hours of the night at 2 o'clock in the morning when you get up to feed. I'm going to be there. Say, like, what do you need? Do you want me to stop by tomorrow? And that's an incredible resource that I think in my experience I've seen go a bit underutilized. I think postpartum folks sometimes feel that they can manage it or they get caught up in everything that's happening. And it's hard. It's really hard to reach out for support. And so I try to implement practices where I'm like, let's schedule your postpartum appointments now, right? Let's pull out our calendars and whatever cadence you want, bi-weekly, once a month, whatever, however often you want to check in, let's get it on the calendar so it's already integrated into your care plan. And I'm just be knocking on the door. I show up. I got your address. I'm here to support. So that's a one piece. I think that is one piece of the solution that we can do. And it goes back to what you all mentioned earlier. We need more data. And that's what I'm pushing for in my own research experiences, is thinking about like how are we capturing data on how individuals with disabilities are utilizing doula services, and what do they need more of? What do they need less of? Is it making an impact on their care experiences? And so that's a really great recommendation. All right. I see some comments in the chat. People are engaged and they're sharing. Tamika shared advocacy can start small, asking questions, bringing support with you, and sharing your experience. And it can grow into showing up in spaces where decisions are being made. You don't have to do everything, you just have to take one step. Yeah. And there's also folks sharing that they feel awakened through listening to today's stories, also other recommendations for training. Thank you all for engaging. All right. And as we get ready to close out, I have one final question for you all. And I really want this question to be focused on our solutions and what we're going to do as a next step. So thinking about today's conversation, what is just one action? Like Tamika said, we just have to take one step. What is one action you commit to taking after this conversation to improve care experiences and outcomes for Black disabled mothers?
I think I'd like to try to volunteer at a OBGYN clinic. I know that I haven't been a new mom in a long time, but I've been through it and I have some know-how.
And JB, you know you can't volunteer. Look, I started volunteer at U of M, and now I'm on the board for the Friends gift shops there. So I love volunteering and being on board at hospitals. I think that's a great idea. For me, I feel like I will commit to helping others share their stories. I lead our Speakers Bureau at Mothering Justice, and I tell people there is power in our lived experiences, and you are the expert based off what you have gone through. And I just love being able to show people or pour into them what I've learned and how to share my lived experiences. So I commit to helping other disabled mamas feel empowered by sharing their stories.
This discussion was actually very timely. I am giving a lecture, or not lecture. Tamika Jackson is part of a panel for Black maternal health that I'm giving to medical students next week, and we hadn't previously planned to include the intersectionality of Black mamas with disabilities, but I'm going to make sure that we uplift and bring that to attention when we talk to them.
Awesome. Really fantastic. And if there's any resources that you all would like to share, feel free to put the link in the chat and we can share those on all of our platforms, in addition to ways that folks can connect with you after today's event. So if you have LinkedIn or social media accounts or emails that you're willing and interested in sharing, you can put that in the chat and we'll make sure that that is disseminated. And we just want to send so much love and gratitude. Thank you all for spending this evening with us. Jamie, Leah, and Christina, we appreciate each of you for showing up to this very timely and important conversation. It's so many things that are happening in this world, and you could have been so many other places, but you're here with us, and we deeply, deeply appreciate that. So thank you. And this is just the beginning. We are excited to continue having conversations and continue building in this space. So I will pass it back to Tamika to close us out.
And for those who may have joined later in the evening, I just want to reintroduce myself. I am Tamika Jackson. I am the Reproductive Justice and Black Maternal Health Organizer at Mothering Justice. And I want to begin with thanking all of our panelists. Thank you so much, Karen, Melva, Jamie, Dr. Leah, for sharing your truth, for your experiences, your insight with us tonight. And thank you to everyone who joined us, who listened, who reflected, and who chose to be present in the space. You might hear my little 3-year-old in the background right now. But what we heard tonight was deeply personal, but it was also deeply connected to what we know. We know that Black mamas are already facing a maternal health crisis in this country, with significantly higher risk and outcomes shaped by systemic inequalities, not individual choices. And we also know that disabled birthing people face higher risks during pregnancy, birth, and the postpartum period, including increased complications and barriers to care. But what we don't have enough of is research, and research that is fully capturing the experiences of Black disabled mamas at that intersection. And when something is not measured, it's often overlooked. When it's overlooked, it is under resourced. And when it is under resourced, it continues to be treated as an afterthought. And that's why tonight matters so much, because these stories are not just stories, they are data, they are evidence, and they are a call for systems to do better. And I want to invite us all to sit with this for a moment. What does it look like to truly support Black disabled mamas? And not just in conversation, but in practice and policy and in the care that shows up after birth. Because support doesn't end at birth. It requires us to rethink about how care shows up in postpartum period, how communities are resourced, how systems respond when Black disabled mamas say what they need. Mother Injustice that looks like advancing policies that expand postpartum care, strengthen access to doulas and midwives, and invest in community-based supports that actually meet mamas where they are. It means making sure that Black disabled mamas are not just an afterthought in these solutions, but are centered, because those that are closest to the problem are the ones that have the solutions. And that's how care is going to be designed and delivered. We invite you to take a step with us in that direction. Join us for our Mama's March. It's going to be coming up at the end of the month, April 29th, where we will continue to show up and speak out and push for the kind of care and support our communities deserve. As Dr. Leah shared with you, I will be at U of M talking to some medical students next week, so that we can talk about what that looks like for them to be advocates in the healthcare space. And this conversation doesn't end here. It continues in what we choose to do next together. And thank you all again for being in the space. If anyone else has anything to add, good night. And thank you all for joining us. Wait, Tamika, you're on mute.
It's time for me to go. But thank you, everyone, for joining us today. This was a great conversation. Please, if you're watching us, YouTube, Instagram, follow, like us on Divas in the City TV on Instagram and YouTube, because we love to continue to have these type of conversations, and you will get a daily showing of aspirational, great women, Black and brown women with disabilities, taking their city by storm. And so please subscribe, follow, and like, and also join our partner, Mothering Justice. So hope everyone enjoyed and have a good night.
Oh, let me add, and if you're looking for more policy information about Mothering Justice, make sure to follow us on social media platforms, Mothering Justice and Mothering Justice Action Fund. You can find us on Facebook, Instagram. Yeah. Thank
Yes,
you.
yes, yes. Bye bye.
Peace, y'all.